J'aimerais prendre son mal.
I want to take away his pain and I want him to have the childhood he deserves. This is Charly Vien Tremblay. He's been waiting for 3 months to receive surgery that's been classified as urgent as Quebec postpones operations in the province due to the surge in COVID cases and hospitalizations. The province's hospitals are overwhelmed, forcing many to move to level 4 protocols, which is delaying or outright canceling non-urgent procedures like Charly's tonsil operation, something his mother says would improve his quality of life and his breathing as he suffers from dysphagia, which is difficulty swallowing, sleep apnea, asthma, and other lung issues.
Ça peut paraître banal, mais pour lui, c'est assez important.
It would seem ordinary, but for him it's extremely important because he suffers from sleep apnea. His tonsils, when he sleeps, obstruct his airways that make his oxygen saturation levels dip several times a night, leaving his organs poorly oxygenated and his sleep becoming less restorative. Charly has been waiting to have his tonsils removed since October. The family was told it was considered urgent and should happen within 12 weeks, but since then, no news. His mom says she's discouraged.
Depuis la naissance, que c'est des victoires, des rechutes.
Since birth, there have been victories with Charly, then relapses. We take 1 step forward and 2 steps back. Every time we think it's almost done, we go back again.
We have to cut in serious procedures, in cancer operations, in some other treatments that are offered in the hospitals that we just don't have the manpower left to give those treatments.
About 20,000 healthcare workers are off the job due to the virus. Over 2,500 people are in Quebec hospitals with COVID-19, with almost 250 in ICU, all pandemic highs for the province. Officials attempting to reduce the strain on the system by offloading hospital beds. Cité de la Santé Hospital in Laval, north of Montreal, is among those.
We haven't turned down any patient with the COVID for an ICU bed, for a ventilator, or for a hospital bed. But what we're doing, in effect, is we're turning down other patients who have been waiting for procedures, who have been waiting for treatments. So we are, in effect, doing some form of triage. And it is stressing to us. As a caregiver, we want to be able to treat everyone.
The situation is expected to get worse before it gets better. Some say Quebecers need to make sacrifices.
Are we willing to maybe not come to the emergency room for the things we're used to come for?
For now, all Charly's mom wants is for people to help stop the spread of the virus so her son can get the operation he needs sooner.
Charly, c'est une personne parmi tant d'autres.
Charly is one among many others. Now it's a 2-year-old child, but tomorrow it could be your son, it could be your sister, or it could be your mother that's waiting on an operation that could be simple or important. In Montreal, Alyssia Rubertucci, City News.